Sorry, yeah. So I think it's really important that obviously we know we're discussing something that's really difficult and quite emotive and quite a challenging subject, and for people who have been affected by pregnancy loss, or for anyone really, it might trigger some trauma or some difficult emotion. So if you do feel affected by anything that we talk about today and need some more support, there's 3 amazing charities that I'm sure we can both link to on our Instagrams after this chat. We've got Sands, Tommy's and Aching Arms, who are 3 of the most wonderful charities that provide invaluable support to parents. So if you feel that you need some extra support or anything's triggered by our conversation, then please head over to them because they really are awesome. So I guess it's useful for us to discuss why we're talking about this subject, and sadly, as midwives and mums who are affected know that the death of a baby isn't a kind of rare tragedy, and that every day in the UK there's actually about 14 babies that will die either before, during or shortly after birth. And what that means for individual families is that almost every 2 hours a family is faced with this devastation. And there's so many reasons why this may happen to people, and there's lots of different terms that are bounced around, like miscarriage, stillbirth, neonatal death, and we can explore those terms in more detail. But I think it's really useful to explain the reason we're saying this, and the reason we're explaining these statistics is because it's likely that you will, if you haven't been affected directly, then you're likely to experience knowing someone who has been, and that might be that someone's returning back to work following losing a baby. So it's not just for people that are affected, but it's also for people who might need to support someone without actually realising what they've been through.
Yeah, I think we all probably know someone who's been affected by pregnancy loss in some capacity. Yeah. And I think it's still such a taboo subject that we don't talk about it to each other, and it's only during these kinds of conversations when we talk about it in like a public forum that people say, do you know what, I had a miscarriage, I've had birth, you know. And it's only when it's brought up to attention that people will actually say, I've experienced this, without offering that information. And it's not, you know, it's a very, very personal choice to want to talk about it. Some people like to talk about it openly, and it keeps the memory alive for them, and that's brilliant, amazing. But some people feel so much bruised inside that they can't physically bring themselves to talk about it yet. So, yeah, I think this is such an amazing platform that we've got here, that we can bring this up so that people have got a little stepping stone to getting a step closer to finding an outlet for it.
Yeah, absolutely. And I think probably just categorising maybe the terms that women might be exposed to and might hear about, and they're generally kind of labels that are really dependent on the timing of your loss, so that the most appropriate care pathway can be followed for each individual. So I guess the earliest category is a miscarriage. And actually about 1 in 8 known pregnancies will end in miscarriage. And we know that this is underestimated because a lot of women will have a miscarriage before they knew they were pregnant. So it is a large issue. And this term is used for a loss of a baby prior to 23 weeks gestation. So that's still quite a long way along your pregnancy journey to be dealing with that. And then the next term that might be heard of is stillbirth. And in the UK, we know that around 1 in every 250 births, based on statistics a couple of years ago, will end in a stillbirth. So again, it's something that is an absolute tragedy, but we are seeing this regularly, and that's why it's so important this taboo is broken, and that those women and families who experience this tragedy have a platform that they can speak out, and that they don't feel like they need to suffer in silence. And many people seem to think that stillbirths happen because of a developmental or a genetic problem that meant that the baby couldn't survive. And for some instances, this is true, but there is kind of actually fewer than 1 in 10 stillbirths where this is the cause. And for many, the cause is never unknown. So about 4 in 10 mothers will never actually find a reason, despite best medical efforts, for finding a cause. And then we move on to neonatal death. So this is the death of a newborn baby within the first 28 days of life. And this affects about 1 in every 360 births. So for these parents who have gone through their pregnancy and birthing journey, and then they're losing their baby afterwards. And I know this all sounds very bleak, and we've explained why we're discussing this, despite how the statistics can be translated. But there is good news in that the number of babies who are dying is reducing. So there was 345 fewer deaths of babies in 2018 than there were in 2017. And there is so much work and effort going into trying to prevent this in all of maternity services. And I think it's just important that we recognise that there is arguably kind of few experiences that can compare to the trauma and the tragedy of losing a baby. And as we were just speaking about, that everyone will deal with this in their own unique way, and it's really important that we respect and are led by that. And then I know we had like a little brief discussion about what we wanted to make sure we covered, and one of the important things was the recognition of reduced movements for mums, and the kind of work and the studies that have been done around that. And
we talk about this constantly. I mean, I've got countless posts on my Instagram about, acting on that reduction in movement, or not feeling any movement for several hours, and not waiting until the next day, and it is such an important factor of pregnancy that it's such a simple monitoring to do that is so effective.
It is so important, because as much as our job would be made 1,000 times easier if abdomens were see-through, they're unfortunately not. So one of the best ways of us determining how well and how healthy and how your baby's coping is from what mums are experiencing. So really that's invaluable, and any episodes of reduced movements, we'd always encourage you to speak to your midwife. And we know that babies reduce their movements if they are becoming poorly, because they want to preserve their oxygen. So that's why it's quite often one of those early telltale signs that actually maybe something's not quite right here. We need to be keeping a closer eye on you and your baby, and maybe doing some extra scans and monitoring growth, etc. So it is something that women always phone up and say, "Oh, I really don't want to bother you," or "I'm really sorry to trouble you," and that's absolutely not the case. Yeah.
And it's never, ever, ever a bother. And I say to women all the time, I would rather see you 100 times and everything's fine than you wait when it isn't, because, 100 times turning up at the hospital is absolutely what we are there for, and it's what we do, and we would rather you did that. We're never, ever a hindrance, don't ever think that. Yeah,
absolutely. And that's what we're here for. It's our job. So if you're sat at home worrying, what's the point in us staffing these maternity units? You need to come and see us. So I'd always encourage, I think we can't stress that enough, to monitor your baby's movements and act upon them. And then, I guess, supporting parents after a pregnancy loss. So SANS is one of the kind of leading bodies in supporting bereaved parents. And it's important to recognise there's no time limit on the support that you receive. So this could be 10, 15 years down the line and they are still there for you, because we appreciate this isn't a pain that goes away with time. And a survey that SANS did highlighted how almost a third of men that had suffered trauma from the loss of their baby weren't offered a referral personally to a helpline or any kind of support service, which, it seems completely ludicrous, doesn't it?
Yeah, because, why wouldn't a dad be just as affected? The emotional support is still needed, most definitely.
And I think it's important we recognise that this support is for anyone affected in that trauma. So whether that's the woman, their other children, grandparents, birth partners and fathers, it is for the whole unit, because we totally recognise that it's traumatic for everybody who's directly involved. And men can sometimes feel sidelined and maybe struggle to reach out and deal with the emotions that they're experiencing. So it's really important, as someone who knows someone who's bereaved, or as healthcare professionals, that we really recognise their role and make sure that we're reaching out to them when maybe they can't speak to us.
I think men kind of don't take on that role of, it's almost like, well, I don't want to be a burden to my partner because he's the one going through it. And so they kind of almost take themselves back a little bit and sort of take themselves a step back, because they don't want to feel like they're a burden, or, you know, they feel like it's going to be, it should all be about the mother. And yes, it is about the mother. It's about the whole family unit. That baby was a relation to all of the family, and it's going to affect everybody.
Yeah, absolutely. And I guess Sans, looking at some of the support services they offer, just so people have a bit of an understanding, they have a service called Befrienders, which essentially consists of volunteers, and these volunteers have suffered some sort of pregnancy or infant or child loss themselves, so they can understand what you're going through, perhaps in a more empathetic way than someone who's not dealt with this experience themselves. And that can be an automatic bonding, really. And sometimes talking to someone who's been affected, whether that's on the phone or a meet-to-meet group, can just provide invaluable support. And they are select, so if mums have experienced loss and think actually they'd like to volunteer for that, they do just specify that it's been a few years since your personal experience, and that obviously you feel emotionally secure and stable to do that. Because a big ask, really.
Yeah, definitely. I'm just reading through the comments, sorry.
Yeah, no, feel free. Tell me if we've got questions we need to answer as we go.
I'm trying to get back to the beginning of my screen, and it's not. There we go. Okay. Thank you for bringing this up. I had a late miscarriage at 23 plus 4 of a 4-year-old and currently pregnant 37 weeks with third baby. So you see, you know, dealing with miscarriage or baby loss, you know, even when you've had 1, 2, 3, 4, 5 babies, the effect never ever goes away. And I think when you've suffered such a loss, you kind of almost have such a heightened anxiety about pregnancy afterwards. It kind of, for want of a better way of putting it, kind of taints it a little bit, because you don't get the enjoyment that you would, because you're not naive to it anymore. And once you've experienced this, I think every single little step, you're kind of constantly wanting to get to the next stage of your pregnancy, so that you can go, right, okay, I've reached 15 weeks, 24 weeks, and you're constantly sort of working your way through. And I think, you know, there is support there for you. You know, if obviously at 37 weeks you've seen your midwife, and you can get support through your midwife. There's counselling services that we can refer to, as well as charities. So do discuss these things, and if it's affecting you, if it's affecting your mental health during your pregnancy, this is something else, another aspect that we need to be addressing as well.
Absolutely. I think sometimes mums that have experienced pregnancy loss in the past almost feel a little bit like a ticking time bomb, and you just feel like you can't quite settle into your pregnancy and enjoy it in the way that you may have previously. And I think that's human nature, isn't it? And all we can do is support and reassure and make sure the appropriate monitoring that's needed from a kind of an obstetric clinical point of view is in place for these individuals.
Yeah, totally. Nancy's first little girl, she lost her first little girl and has gone on to have 2 boys. I know Nancy. And she says here, the first thing that her husband did was go out and play basketball, and that was incredible because there wasn't much support for him. Yeah, so
it's sad, isn't it? It shouldn't be the way it is.
Exactly. How can you enjoy a pregnancy more positive after having miscarriage? You can't. It is just that whole mental block of not allowing yourself to enjoy the pregnancy because you just don't know what's around the corner, and that's the of it. to fairly early miscarriages, 8 and 14 weeks, now 34 plus 5, every time I go for a scan, I hold my breath for that heartbeat. Absolutely.
Yeah,
Absolutely.
and that's totally understandable, isn't it? And I think when we talked about people coming in with reduced movement, and sometimes if you have suffered a previous loss, it's completely understandable that we might see you attend more times than someone who's previously had a straightforward pregnancy or is having their first pregnancy. And please don't ever worry about feeling judged with regards to that, because as we say, that's our job. We want to be there to support you and to try and make this subsequent journey as smooth and as less emotionally challenging as possible.
Yeah, absolutely. You know, the movement is such a key thing, and like I say, we talk about it all the time, don't we? There's also recent research, I can't remember if it's Dan's or Tommy's, I think it's Tommy's actually, that say that they found recently that women side sleeping, so sleeping on their side in the 3rd trimester, also helps to reduce that risk of stillbirth.
Yes, yeah.
You know, it's one of those things you do everything within your power to protect yourself and your baby. So another piece of evidence that sleeping, and I get asked all the time, I wake up on my back and panic because I've woken up on my back. Well, that's fine. You know, you can't control what you do in your sleep. If you wake up and you're on your back, just go back on your side and go back to sleep again. You know, don't panic that you've done anything wrong. If you wake up on your back, it's fine. Just put yourself and go back to sleep.
And the study, it was Tommy's, and what they looked at was where you started sleeping, because they said that where you fall asleep is where you're likely to spend the most time during your sleep. So even if you make an effort to fall asleep on your left side and then you wake up on your back, consecutively over the course of that night, you will have spent likely the most amount of time on your left-hand side. So it's a balance.
Okay, so miscarried twice in 2018, had my baby girl in 2019, had another miscarriage in June, just gone. Is there something wrong with me? Can I be tested? I'm so scared to be pregnant again.
Oh.
So you need to speak to your GP, okay? Speak to your GP, because there is blood tests that can be done to rule out certain conditions. Things like lupus is one of the tests that can be carried out by blood tests to see if there's any other conditions that are, preventing you from carrying a pregnancy. And, and also if you've had subsequent miscarriages, one after another, there's a reason for referral as well. So it's always worth speaking to your GP, absolutely.
Yeah, definitely. It definitely sounds like you need to have some further investigations. Because it might be something that's treatable. You know, if it's something that can be treated and then you can move on, then fantastic.
And, it's understandable that people are anxious. Like I say, once you've experienced that loss, it affects everything going forward. And your anxiety is heightened, your emotions are heightened. You almost kind of put a bit of a guard up. And, it can also lead to a bit of antenatal depression as well, and that shouldn't be ruled out, and that should be looked at as well. There's, a kind of like a domino effect that happens, and you need to really look after yourself and make sure you've got plenty of robust support in place.
Absolutely, yeah, definitely. It's no one can tell you or fully explain what the loss of a pregnancy or a baby feels like for you, because we are so individual. And different support mechanisms will work well for different people. So it's definitely worth exploring all the avenues that are offered to you. And then the other thing I just wanted to highlight is the importance, I suppose, of making memories. So this relates mainly to stillbirth and potentially also neonatal deaths. So making memories is a broad spectrum, I guess, kind of like an umbrella term for all the potential things we can do to help you. And we recognise, especially in hospital, that you've got quite a limited window to make a lifetime of memories with your baby that you kind of pictured in your head throughout your pregnancy. You picture all these things that you're going to do, and then in an instant, all of those future memories are taken away from you. So it's a valuable time for us to really try and get right and really tailor to individual people to make the best of this absolute tragedy that we can to help you with your grief. And it's whatever feels right to you at the time. So you'll be offered all sorts of options and services, and there is no right or wrong. We'll be entirely led by you. Sorry, paused it because of connection. We back? We're back. So yeah, the making of memories. So some of the things you'll be offered. So some parents want to have that immediate skin to skin with their baby when he or she is born, like they would have done with a live birth baby. Others don't want to see the baby at all. Some want to see the baby, but once the baby is all dressed and wrapped in blankets and things. And so these are just honest conversations to have and do whatever feels right for you. And if you change your mind, that's absolutely fine. There really is no concrete plan or right or wrong.
Absolutely not. And I don't really think you know how you're going to feel about something until that moment arrives. So it's worth, just exploring different options and saying, okay, no, I'm actually not happy with what I'd rather do this, and really sort of be vocal about it, because that time is so precious. That time is it's such a finite window of opportunity that you want to get it right for you and how you feel and what's right for you and your family.
Absolutely. And then some of the other options are things like hand and footprints or casts that can be done as well. Photographs again are really personal. Some parents want to have like a family photo shoot, so they have them, their baby, maybe even grandparents or other children come in for that, and that's absolutely fine. Others would like just photos of the baby popped in a sealed envelope, and then they'll view them in their own time and in their own space. Again, it's very flexible. Things, nice little trinkets and things to remember. So we have some little key rings that have been donated with a little heart in the middle called Heart in Your Hand. So this is where the heart goes in your baby's hand and you take the key ring. Swapping of teddies or blankets, so where babies have one teddy and mum has the other, and then when you say your final goodbyes we switch those over. And these are all just little things to just recognise, I suppose, when you're leaving without your baby, but you've still created these memories and all this bonding with your baby. You want to have some memories to take away, and they're just so precious.
Yeah, absolutely. And it is such a tough time. You never expect to leave the hospital without your baby. It's just not something you factor into the pregnancy journey. And that, I think this chat is kind of more about sort of highlighting the things that are possible for those people that, have experienced this, and to reach out to other people that have experienced it as well, to share your experiences. Oh, Nancy's put the handprints and footprints, she's still got them in her box.
Oh, they are so precious and so beautiful. And we know you're never going to forget your baby, but it's really powerful that we can provide you with little personal things like that, just to really, really concrete those special moments that you had. And then I think as well. Yeah.
Sorry.
No, carry on.
Photographs, because there might be some that panic thinking, well, I never had photographs. Most hospitals will take photographs. They will have asked you for permission to take photographs. You may or may not have agreed to that permission, but if you have agreed to it and photographs were taken but you didn't get them at the time, they should still be available to you. Yeah. So it's worth contacting the hospital just to see if you changed your mind and you would like to get those photographs, if that is possible for you to do. It's worth asking.
Yeah, that's a really good point, actually. And sometimes we will say that if you say no to photos, we say, well, how do you feel about us storing some for you so that you can request them at a later date? So I guess moving on to how to support somebody who has been affected by pregnancy or infant baby loss. And as we said, most people are likely to know somebody who's been affected. be that someone close or a work colleague, etc. And it's always a really difficult conversation. Some people find it quite uncomfortable and quite awkward. So it's quite useful, I guess, to know how you can combat this and overcome some of the barriers. And mums generally, everyone's individual, but generally they really appreciate you communicating with them in some way and not acting kind of like nothing's happened when their entire world has just been shattered. So just recognising their loss and recognising that they've had a baby.
Yeah, because it's happened. It has happened, and that baby is that person's baby. You know, it's their child still. It's their baby. You know, whether they've brought them home or not, still part of them, and they will want to be remembered forever.
Absolutely. And I know people are always really worried about causing offence or saying the wrong thing, but generally women would rather you said something than absolutely nothing. So just recognising their loss is really important. Talk about their baby. Ask them if they had a girl or a boy, what their baby's name was. This is still a person, albeit they were born asleep. They're still a person. So recognising that and then be led by them. They may then start to discuss a lot about their birth journey, so you can go with that. And if that's kind of the conversation just shuts off and turns to something else, then again, take that as a lead that that's enough for that person to be discussing with you.
Absolutely. And I often feel like you can just say to somebody, I don't know what to say, because just saying, I don't know what to say, just leads that conversation, you know, and you can say, I'm very sorry, I really don't know what I can say, and they will reply with what they need from you, and that's always a good lead of that conversation. That's a really good thing, Sarah. If you are just totally shocked or perhaps you didn't know and it's all a bit last minute, then that's a really great way of just saying, I don't know what to say, but I recognise that I don't want to just ignore this horrendous tragedy that's happened to you and your family. And then I suppose if you are a maybe closer person to this woman, or a friend, family, relative, it's really important for women that their baby isn't forgotten. So it's not uncommon that in the first few days and weeks everyone kind of comes around and says all these things to you and supports you, and then that kind of drifts off. So recognising this baby's first birthday, maybe getting some little trinkets and things like that, and little memories that mums and dads can add to their memory boxes, so that they just build these continuous memories and recognise that actually everyone's remembering their baby and not just them. Your baby's not just been forgotten or replaced if they have a subsequent pregnancy. And then I think things that perhaps we should avoid saying, so things that maybe aren't very helpful but quite often crop up, are things like, well, at least you can get pregnant, or you can just have another baby, or time's a good healer, tough things only happen to tough people, things like that really kind of minimise the loss, and they don't recognise what this woman's going through. So steer away from those phrases. I know they're always said with a good heart, but they can be interpreted in a quite uncompassionate way. Totally. There's a very good question here. Will being anxious during my pregnancy have an effect on the baby? I mean, not a detrimental effect. You being stressed is going to have an effect on your pregnancy. And you don't want, an over amount of, adrenaline, hormones, cortisol, those kinds of things affecting your pregnancy long term. So whilst it won't have a detrimental effect on your pregnancy, it will have an effect in as much as you don't want to be anxious and stressed with your pregnancy. So it's worth exploring avenues to help you cope with that anxiety during pregnancy by means of referrals for talking therapies or mindfulness, or even meditation, or like yoga or Pilates, something that's going to help you to relax and just kind of take out the stress a little bit. It's a difficult one to answer, because you don't know what kind of stress you're under that's going to affect your pregnancy, but exploring ways that you can help with the anxiety through pregnancy for anybody for whatever reason.
Yeah, especially at the moment with the global pandemic, I'm sure there's lots of pregnant ladies that are feeling quite overwhelmed and anxious.
Absolutely. I mean, just given the audience that we've all had over the last few months, and the questions that we all get and the feedback that we all get, we all know that women are anxious and scared and worried, and and that's without added stresses. That's the new normal at the moment.
Yeah. And we've just got a lady who just said, I got told that things happen for a reason, not the right thing to say. No, absolutely echo that. And we know people say these things with a heart of gold, but it's just not helpful or compassionate, because you think, what could possibly be the reason for a innocent newborn baby not making it? I mean, it's just not helpful things to say. So top tip for people who are supporting someone who's bereaved is try to offer compassion and support. Remember that it's better to say something than nothing. So recognising their loss and making women and family members feel like they've got this kind of army of support and love around them that are full of people that will never forget their baby and that will help them to cherish their baby and help them to make memories, not just now but for the future as well.
Yeah, definitely.
And then I suppose if it's somebody who you're not going to speak to, especially in the world we are at the moment, that's a real possibility. So send that text, phone someone and leave a voicemail to know you're thinking of them. And don't be offended if you don't get a response. But just for them, knowing that you are out there and you're thinking of them and you're there when they feel ready to reach out can be really valuable source of support.
Yeah, it's so important.
Definitely. And we know, I guess, leading back to our lady who was speaking about anxiety and the current situation with COVID-19, is that we know that if you are pregnant following a stillbirth or neonatal death, then it's already a time of massive emotion and anxiety and stress. And the circumstances at the moment with the COVID-19 pandemic are only going to intensify those feelings. And you've probably got loads of questions about what will happen. So it's really important that you do speak up and you talk to your GP, your midwife, the maternity staff, so that you can get reassurance and we understand this is a really anxiety-provoking time as well.
Yeah, I mean, not every trust, but a lot of have dedicated bereavement midwives, and they are so invaluable because they know exactly what referrals to make to who and who to point you in the direction of, but also they see a very small amount of women, so they have much longer appointment times with you, and that is just so crucial to your pregnancy journey after a loss. So bereavement midwives are amazing midwives, absolutely amazing. It's important that not every single trust in the country has them, because they are just such an amazing group of women, and if you're lucky enough to have that in your trust, then brilliant, and I would utilise them really.
Yeah, absolutely. I definitely echo that. They are incredible. And I guess the other benefit of having dedicated bereavement midwives or a team of bereavement midwives is the fact that you get that continuity, so you don't have to keep explaining your story. They know you, they know your story, they can unpick a little bit more with you at each appointment, and you feel confident in doing that with them as well.
Yeah, and also I think a lot of trusts now have separate notes for women who've had a previous loss, so that those women are identifiable. If they do come across somebody that they've not met before, that they're identifiable by their sets of notes that stands out to say the woman's had a previous loss, and therefore they won't ask you inappropriate questions, or they won't ask you to repeat the story over again. They can actually identify you as having a previous loss, and therefore read about what's happened, and they can identify that way. And that's a really important thing.
Yeah. Yeah, definitely. Sometimes it's just like a sticker on the front of the notes, but it's that little bit of identifying what you've been through, so your care can be tailored.
Yeah, definitely. Someone's saying about more communication between bereavement midwives and patient post a loss. Not sure what you're sort of saying between, like, communication between the midwives and you as the patient, or between midwives for the patient. I'm not sure. Clarify and I'll come back to that.
Yeah.
Okay. Pregnant again after 2 miscarriages. Will I lose my baby again? I had 1 successful pregnancy followed by 2, 1 chemical and 1 10 weeks. No one can guarantee the outcome of a pregnancy, sadly. There's no way that we can know what the outcome of any pregnancy will be. But, the odds are in your favour if you're looking after yourself, if you're, eating good nutrition, good hydration, resting, mobilising, looking after yourself mentally and physically. The odds are in your favour. No one can guarantee what will happen, and sadly, 2 sad losses and going to have an effect on anything going forward. It's always worth having a chat with your GP, a chat with the midwife about preconception care before falling pregnant again, and just, really preparing yourself as best you can for a pregnancy.
Yeah, definitely. And our health does have a massive impact, but there's so many factors. And especially if you're someone who has had a few miscarriages, and it is important that you speak to your GP to just test for anything else that might be underlying. And just about the preconception stuff, I actually did a little chat on your Instagram TV, so you can head over to that on Carla's page as well with some information.
Definitely.
Okay.
Yeah,
Has anyone got any other questions or queries for us? Otherwise, we'll leave you to get on with your afternoon. But I really hope that we've been able to, do justice to the parents that have suffered from loss, and to help them feel like their voices can be heard, and actually we can use this platform to really break that silence and break that taboo and get people talking about it and recognising it and making sure that the support that is so needed out there for people that have been affected is present.
Yeah, totally. I apologise for my Wi-Fi. I keep cutting out. I'm sorry.
Right.
Yeah, it actually starts a conversation among people. If not on this page, but on any of the other pages. Stan's, Aching Arms, Tommy's. They've all got Instagram pages that you can go and follow. They all update with lots of information regularly, and they're really trustworthy charities and organisations that you can follow for more advice.
Yeah, most definitely.
Here we go. This is the clarification. NHS trusts need more in place to patient care after a loss. Yeah, as I say, not every trust has a bereavement team of midwives, and that is something that would massively benefit to every trust. Sadly, it does always come down to funding, which it really shouldn't, but it does essentially. Sadly, that's just how it is. But there is other resources which we will link to on this chat. We will link to those, and hopefully, speak to your local maternity voices partnerships. Speak to your local MPs about what bereavement care is in place at the local going.
Yeah, and unless people speak up and say that actually in my area there wasn't the support I needed, then nothing's going to change. So your voice is so powerful, much more powerful than us as midwives saying it. It needs to come from those people that didn't receive it, or did if you've had a positive experience, but your voices are 100 times more powerful than ours. So please use them.
Definitely. Brilliant. Thank you so much, Pip. I am really pleased that you've taken the lead on that, because I'm barely stringing the words together at the minute. But
Oh, I hope you managed to get some rest. And as I say, we'll both link to those support charities. So if there's anything that we've discussed that has brought up any issues with you emotionally and you feel like you need some extra support, then you can head over to them for that. All right.
Perfect.
Have a good afternoon.